Hello, my name is Leonard Chavis. I will be doing a presentation on sporotrichosis, a type of fungal infection. Sporotrichosis goes by both its technical name and rose handler's disease, and there are three other variations. Sporotrichosis is an umbrella condition that has 4 different bacterium that may cause it ultimately. S. brasiliensis is a South American strain that can be passed on by cat bites or scratches, but may also be present in contaminated plants. S. globos is a worldwide strain, but is mainly found in West Asia and is spread by contaminated plants. S. laurii is limited to Africa and Asia due to its low pathogenic rate than most other strains and its slow adaptation. S. schenckii is a worldwide strain that spreads via contaminated plants and grows best at around room temperature. The microbes of S. schenckii on the right are lying on an agar plate and seem to form like a jellyfish type bacterium. It is a fungal infection that often affects field hands and farm workers that do not utilize proper PPE when dealing with an unknown type plant. The bacterium is a dimorphic fungi that grows best at about room temperature or a little colder. Infections are often caused by either touching the contaminated matter, either with or without cuts present on your hands, or breathing in the spores while handling this type of material, any contaminated plant matter. Most severe cases will be present in pulmonary sporotrichosis, and if it spreads to any other part, it becomes disseminated sporotrichosis, which is often most detrimental to those that have pre-existing health conditions or currently on immunosuppressants. S. schenckii has several notable virulence factors, one of which is a fungal cell wall containing several PAMP patterns, which allow it to bypass a host immune system by fooling the pattern recognition receptors that are searching for any viruses or invaders. Schenckii also is capable of producing a biofilm that makes it really hard to remove once it's taken hold of a host. Schenckii uses a variety of cell wall proteins to grab on and keep held on to host. Adhesins such as GP70, HSP60, and PAP1. With most symptoms being lesions or pustules resulting from extra and intracellular proteinases that degrade skin constituents and cleave antibodies, ultimately causing many of the symptoms associated with sporotrichosis. Finally, the presence of thermotolerant proteins such as PAP1, BRK1, and SSCMK1 allow the microbe to survive in higher temperatures, such as fever, and affect the morphology of cells. This basically prevents the microbe from dying inside of the human host, as it is capable of adapting with our temperature, just in case it is not able to bypass the pattern recognition receptor until it can form a biofilm and spread. Symptoms of sporotrichosis for less severe or mild cases are a painless red papule, lesions that may not appear until up to a month or 6 after exposure, and a lymphocutaneous spread. While chronic symptoms could be skin lesions that come and go for years, pulmonary symptoms of coughing and fever, possibly even weight loss, as well as many types of swelling in the joints or bone. CNS It could spread to the central nervous system, but that's a worst case scenario and does not have many documented cases, but has been known to occur. The most common way that sporotrichosis, and in particularly Schenke, spreads is via contaminated plant matter and improper use of personal protective equipment when handling said matter. Alternatively, it can spread via animal bites, but is not as associated with animals as the Brasileña strain found in South America. Individuals that handle sphagnum moss, rose bushes, and hay are more likely to be infected by the Schenke strain. The symptoms often are diagnosed in a lab and can be a cigar-shaped budding yeast type appearance. Schenke is a pain to treat via medications as many fungal infections. Due to the nature of Schenke, it requires 2 weeks of antifungal therapy before you can even begin true treatment. You must undergo 2 weeks of antifungal before they can take the measurements to give you proper amounts of medication to wipe out the Schenke strain. Less severe pulmonary infections and cutaneous are often treated with itraconazole, and severe or disseminated infections require amphotericin B. Upon lesions disappearing, therapy is continued for up to 2 to 4 weeks to ensure the bacterium is dead, or the fungus rather. Patients will often require upwards of 3 to 6 months of antifungal therapy just to ensure, because you really don't want it reoccurring. As prevention, the CDC recommends basic PPE being gloves and long sleeves and long pants to avoid coming in contact with any infected plant matter, while also avoiding unfamiliar animals to ensure you don't contract this infection. To identify the Schenke strain in a lab, a direct examination for budding yeast can be done in a 10% potassium hydroxide wet mount and will be stained gram-positive. Cultures can also be grown on a Sporotrichosis agar for a filamentous hyaline colonies in about 5 to 7 days at 25 degrees Celsius. The blood agar will show off the dimorphism of the fungal infection at 35 to 37 degrees about room temperature in 5 to 7 days. And potato dextrose agars will show the conidiogenesis of the Schenke strain. Combined, you can use these 3 or 4 results to identify which of the 4 strains you're dealing with. Ideally, because it is often misdiagnosed as a tuberculosis or many other skin type infections due to the lack of obvious symptoms. So these are the sources I used when pursuing research into Sporotrichosis Schenke. Overall, proper protective equipment is the only real prevention you have for such a fungal infection. Other than that, avoiding any stray animals that you might see out and about in areas like a farm or a ranch would be a pretty safe bet. But overall, the disease only really harms you if you already have underlying conditions or if you have immunosuppressants. And without extensive lab work, this disease or fungal infection is often misdiagnosed as types of tuberculosis or other skin infections due to lesions being the only real symptom you can physically see, requiring you to do the lab work in order to properly diagnose and treat this condition. I wish you all a great day. Stay safe.